没问题。
现在很忙嘛。
那今天
是，谢谢邀请。我们现在是一个非常态的工作状态。
可以想象，尤其是最近这2天，第2批疫苗又到了，所以一系列的工作全都是铺天盖地的在展开啊。所以非常感谢这个时间接受我们的邀请。
没问题。
等一下是我们的孔院的同事 Miss Sophia 来做主持人 MC。
Good afternoon, Miss Yang. Would you like to have a test run of your slides book just to see if it works well?
Do you mean the slide or
yes,
test slide?
The presentation, maybe we can check.
Can you see it?
Okay, po. We can stop sharing.
That's good.
Thank you po. I think the webinar has started now po.
Sorry, Sophia. Dr. Ho is here?
Not yet, but we now have attendees. Okay.
Okay.
Good afternoon,
so we can have
everyone.
our background.
Good afternoon,
please.
everyone. Please be reminded to keep your microphones on mute and your cameras off. We will be having a Q&A session after each of the presentation, and you may send your questions through the form linked in our chat box. The webinar will start in a few minutes.
Beverly is trying to come in now. Dr. Beverly will in a few minutes. Dr. Beverly will be here.
keep your microphones on mute and your cameras off. We will be having a Q&A session after each presentation. You may send your questions through the forum using our chat box. The webinar will start in a minute. Good afternoon, distinguished guests, speakers, and to all our participants. Welcome to the webinar on COVID-19 control and vaccination, organized by the Confucius Institute at the Ateneo de Manila University. I am Sofia Constantino, and I will be your MC for today. To give us the opening remarks, we have here today the Director of the Confucius Institute at the Ateneo de Manila University, Dr. Helen H. Palanca.
Good afternoon, ladies and gentlemen. Can you hear me? Welcome to this. Can everybody hear me? Sophia?
Yes,
Yes,
we
Dr.
can hear you.
Blanca,
Yes, Dr. Palanca.
we can hear you.
Okay. Welcome to this webinar on COVID-19 control and vaccines. At this point, when here in the Philippines, we are experiencing sharp resurgence in the number of COVID cases and have returned to ECQ lockdown of the NCR Plus region, we look to vaccines as a solution to contain this dreadful virus. In the same way, diseases such as smallpox, chickenpox, and polio have been eliminated with vaccines. However, COVID-19 is much more complicated. There's still a lot of unknown with respect to the virus itself and the vaccines for it. We need more information that is science-based and given by experts. The objective of this webinar is to present information on this important topic as a public health service. Last year, the Ateneo de Manila University Confucius Institute presented a couple of forums on TCM, or traditional Chinese medicine, with the same objective. Like our previous health forums, the forum this afternoon is in no way a platform for any political or business interest. This afternoon, we are very honored to have as our speakers two very distinguished experts, Dr. Beverly Ho from the Department of Health here in the Philippines, who will talk about COVID-19 vaccines in the Philippines. And we have also the General Manager of Sinovac, Ms. Helen Yang, who will talk on how the global community can promote health, world health, through partnership and proper ethics. In using this vaccine. China has made 2 donations of Sinovac vaccine, a total of 1 million doses to the Philippines. Yesterday, the Philippines, among its orders of different brands of vaccine purchases, received its first order of 1 million doses from Sinovac. According to our ambassador in China, Mr. Chico Santa Romana, after this first delivery of 1 to 2 million per month is expected until the total order of 25 million is reached. We would like to thank Ms. Yang for facilitating these donations and orders. During this time of pandemic, our speakers are extremely busy. We certainly appreciate very much that they obliged to our invitation to speak at this webinar. We look forward to their insights on this important topic. On behalf of the Confucius Institute at the Ateneo de Manila University, thank you so much, Dr. Beverly Ho and Ms. Helen Yang, for being our speakers for this afternoon. I also thank all of you for taking time out to join us for this event. Thank you and have a good afternoon.
Thank you very much, Dr. Palanca. Again, we would like to remind everyone that this webinar is intended for knowledge sharing and that CI at ADMU is in no way representing any government or company. Okay, now allow me to proceed. Okay, allow me to introduce our first speaker. Dr. Beverly Lorraine C. Ho is currently the Director of the Health Research Promotion and Communication Service, and she also serves as the Director of Disease Prevention and Control Bureau. More importantly, she is the Special Assistant to the Secretary of the Department of Health. She is also a member of Scientific Council for Global Burden of Disease at the Institute of Health Metrics and Evaluation in the University of Washington, Seattle. Dr. Ho obtained her Doctor of Medicine from the University of the Philippines in 2009. She also has a Master in Public Health from the Harvard T.H. Chan School of Public Health in 2015. During her internship from 2009 to 2010, she was awarded as overall outstanding intern as well as most outstanding intern in surgery, pediatrics, anesthesiology, and neurosurgery. Again, let us all welcome Dr. Beverly Ho. May we invite Dr. Ho to please share her slides. Thank you so much.
Good afternoon, everyone. Thank you very much for this opportunity to join all of you in this learning session. Special thanks to Dr. Tan for reaching out to me early on last week. So I look forward to joining all of you this afternoon. Can you see my screen now?
Yes.
Yes, yes.
All right, so let me begin by just saying thank you to a few people who made this presentation possible. That would be my team members in the DOH, the Philippine Society for Microbiology and Infectious Disease, Director General Eric Domingo of the FDA, and Dr. Edsel Salvania. I also would like to declare that I have no conflicts of interest, in particular for the brands that will be mentioned during the course of the presentation. So first of all, before we go into the details of vaccination, COVID-19 vaccination, it might be good to situate the entire COVID-19 vaccination program in our pandemic response. So most recently, as mentioned by Dr. Palanca, we have been seeing rapid increases in cases, and perhaps many of you would be wondering, if you still haven't been getting it from the news, what are the sources of these rapid increases in cases? we could break it down into three main points, which would be breaches in minimum health standards. That would mean transmission at home or in workplaces, particularly amongst people who are not in the same bubble, so to speak, or very simply put, people who aren't supposed to be taking off their mask, but they do so, and in fact, they even eat together. So we've seen this in many recent infections in hospitals and healthcare facilities. Many of you also are asking, isn't it we've already vaccinated the healthcare workers? Why did they still get COVID even after that? Remember that they've only gotten their first dose, and the full protection from the vaccines haven't even kicked in yet. No? So even if we've all, for example, many of our participants here who are senior citizens, some of you would be getting already your vaccines in your local government units. Please don't just lay low and not do all the minimum health standards, because the first dose of vaccine does not mean that you're already getting the full protection. Typically, it's even 2 weeks after the second dose. Then the implication of this is that our hospitals have become understaffed, and we've also seen increase in the share of infection for workplaces. The variants are also there. Yes, they made the virus more transmissible, but not necessarily more fatal nor deadly. But what is important is the variants have no other pathway except breaches in the minimum health standards. So yun pa din, kahit nakakasawa, wear your mask, face shield, physical distance, that's still really our best protection. Then finally, delays in quarantine or isolation. So if you actually do not feel well, it's about time that you isolate yourself even before you get yourself tested. No? So these are the main drivers that we have seen for the rapid increase in cases. So many are asking, what does our data say and what will this imply for the vaccination program? Currently, we in the NCR are on ECQ temporarily to slow down the surge, to stop the spread of the variants, to also allow our health system to recover and really protect more lives during this process. And later on, you'll see that part of the vaccination program will already be changed in response to the current surge. So our national framework for the response is still what you see on screen, which is doing prevention, detection through testing, and contact tracing, isolation, treatment. But a huge part of the reintegration or the recovery of the economy will also depend on
Okay, apologies for the technical difficulty. Let us wait for Dr. Ho. Okay, good afternoon, everyone. Apologies for the technical difficulties. We are waiting for Dr. Ho to rejoin our meeting. Okay. A reminder again, you may send your questions to our speakers. The link for the Q&A is posted in our chat box. Thank you so much.
I apologize. I think I got disconnected. All right, so I'm back. Apologies. So as I was saying, for the vaccine to get from the manufacturing plant into our arms, from another country into our country requires a set of processes. And these processes are summarized into these 7 bullets, which constitute the vaccination program of the country. So there are a lot of different agencies, not just the Department of Health that's in charge of the different processes, because there are some things that are beyond medical experts, like diplomatic engagement with several other countries, or procurement, for example. So what is clear to us, first and foremost, is that the vaccines will constitute another layer of protection amongst all other interventions that we're currently undertaking already. So even if all of us are fully vaccinated, there's no advice to stop wearing your face mask, physical distancing, etc. And to a certain extent, you can look at it as a way for us to, say, prevent mosquito bites. You actually don't do just one intervention of, say, Katol at home, but really do a set of interventions that help protect you, your kids, or your family. So first of all, we want to know, how do the vaccines work? No, not necessarily COVID vaccines, but in general, how do vaccines work? We all want a level of immunity from these pathogens, and you can get this immunity either through natural infection or through immunization. Obviously, when you go through the natural infection, you get infected by an antigen, no? So the real bad guy. But when you get immunized, that bad guy gets transformed into something called an immunogen, which can trigger the same immune response in your body. So in any case, you become immune. No? However, it's important to note that when you go through the process on the left-hand side, which is natural infection, there are risks. The risk for it to become a severe infection, for example, while on the other hand, if it's through immunization, the effects are more controlled because they are studied, right? So you have a predictable list of what possible things may happen to you, like get fever, headache, body malaise, for example. So when we talk about getting ourselves vaccinated, vaccines are one of the best public health interventions, and the concept of herd immunity always comes up. And when we talk about herd immunity, it simply means that there are members of the society who will be able to benefit from what we are all expecting to benefit from when we're immunized without having to do so. No? So if you look at the first 3 boxes on top, we are all considered blue persons, blue bodies, no? Naive, susceptible population, such that when someone who's infected, a red person, goes around, we also become infected. After that person becomes infected, he or she becomes immune by becoming this yellow or orange person. And eventually, as more people get infected, more become orange, no, or become recovered. On the other hand, the boxes below show you that we begin with more orange people because they have been vaccinated, so they do have some form of immunity, such that when this person, an infectious person, goes around, it is unable to infect the persons around, or the orange persons around, because they're already immune. But then you will ask, why are there still people that are blue, no, or remaining susceptible? So some people are not eligible to get vaccines. For example, those with really worse forms of allergic reactions, such that they can die from certain components of the vaccine because they couldn't breathe, etc. So they're really not eligible for vaccines. So by making sure that all of us, or most of us, are vaccinated, they do get the added benefit of not needing to get vaccinated, but free ride from the benefit. No? So it's like riding the school bus without having to pay for the fees. No? But we're doing it for them, not only for ourselves, because they cannot afford to take the vaccines. So this is the concept of herd immunity that we actually want to impart to all of you. That's why we need as many of us to get vaccinated. It's not enough that it's just you, your family, your entire workplace as much as possible should be vaccinated, your entire community as much as possible. Many also do ask us, so are the vaccines scary? Basically here, you will see on the left-hand side of the screen the different types of immunogens. So these are either the whole virus or parts of the virus or just the brain part of the virus that's being included in the vaccine. No? So it could be an attenuated live virus, a whole inactivated virus. But this slide seeks to show all of you that for many of the diseases, look at the last column on the right-hand side, we are already using these technologies to protect ourselves or even our kids from these conditions, no? Nagpapabakuna naman ng measles, no, yung mga anak nyo, for mumps, rubella, flu vaccine every year, what we use, no? So it's all here, and what we want to assure you is that the entire science of vaccinology is not built overnight. No? So the vaccines may have come quickly, but that's really because of years, decades actually of scientific studies already on these vaccines. So very simply, how do vaccines work? Why are there different types of platforms that we're using? Sometimes people appreciate it better, like how does the Moderna vary with the Pfizer, or how does it vary with Sinovac and AstraZeneca? Simplest way I could describe it could be like there are different platforms for a computer. So you have Linux, you have Apple operating system, you have Microsoft, right? But all of them do the same thing, which is to allow you to communicate. And the same way, that's how vaccines work too. There might be different forms of vaccines, but the goal is the same. What is the goal? To make sure your body recognizes this bad guy even before it comes to you. So, kunwari, you have hold upper in your community, a shoplifter. If you don't know how that person looks, if the barangay doesn't post like a wanted sign or announces in your chat group, then you might actually be talking to that person when you're doing your errands, shopping, whatever. But when the guy's face is actually posted already and you know it, then you know that what your response needs to be when you finally meet that guy. So that's essentially what the vaccines do. It primes your body so that you already know, you have a mental picture of who the bad guy is. So you will see here on the screen the different ways that the different types of vaccines work. No? So be it a nucleic acid vaccine like Pfizer or Moderna, a protein-based vaccine like AstraZeneca, or a whole virus, no? Like Sinovac. So if you will see here, all of them, it might look very complicated, but I tried to put in a circle what the endpoint is, which is this amoeba-like figure called an antigen-presenting cell. No? Imagine it that it's the tree that holds the wanted sign like this. No? So the antigen-presenting cell is the one that presents the red dots or the coronavirus spike peptides to your body so that your body will generate the immune response. So whatever the first few steps are, it doesn't really matter. No? In the end, it's always this antigen presenting cell having all of the coronavirus peptides in its fingers, diba? And when that happens, in the vaccination process, then you get your immune response. So are they comparable? Yes, of course. No. Will it be important to choose which vaccine is for whom? Technically, no. No. So all the vaccines are comparable in their effect. But of course, some vaccines are better for older people, some are better for clinically healthy people, etc. No? So, but in general, they all have the same effect in our body. So specifically on COVID-19 vaccines, there are 3 promises that have been provided, or these are called endpoints in the many studies that we have. First is to prevent symptomatic infection. Ibig sabihin, normally if you would have COVID and you had sipon, then you wouldn't, after getting vaccinated, you may still have COVID, but you won't be symptomatic. No? Second, prevent severe infection. You might get COVID, but you won't become ICU level COVID, right? And I think this is the most important part, no, that we want to emphasize. COVID is primarily a respiratory infection. But kung respiratory infection lang, ubusipon, trangkaso, we shouldn't actually be afraid of it, right? But the fact that there are percentages or parts of those who contract COVID who die, that's what set the world ablaze. No? Dun tayo natakot. So actually, this outcome is the most important for us, preventing severe infection. Because if you're able to do this really well, if the vaccine is able to do this really well, then it means that you might get COVID, but the thing that we most fear about wouldn't really happen, no? Which is matoxic, ma-ICU, diba? And then finally, another outcome is preventing transmission. And for this, we need more evidence on it because so far, the transmission blocking effects of the virus is still not solid. No? So it's really the preventing symptomatic infection and preventing severe infection. So let's quickly go into the next part, which is how do we ensure the safety and efficacy of the vaccines that arrive in the country? We do have 5 independent vaccine expert groups that actually help us determine different aspects of the vaccination program. And you'll see them all here laid out on screen. No, I won't go through them in greater detail, but each has their own expertise and they're not beholden, no, to anyone. They can say what they need to say. So rest assured that when they approve a certain vaccine, then you can rest easy, no, that it has been evaluated correctly. For example, in terms of the vaccines that have been shortlisted or the ones that our country is negotiating with, 6 of these criteria are put out here on screen. No? Track record of the company, the platform that's used, its safety profile, etc. Oops, sorry. Okay. Then we go to why are the vaccines under emergency use? So typically, the vaccines go through these stages from preclinical to phase 3 trial. And in our country, for many of the vaccines that we've had in the past, they usually finish phase 3 trial before they go into the market, before you can get it from your private pediatricians, for example. But for this particular COVID vaccine, none of the vaccines have finished phase 3 trial. But because of the nature of the emergency, the benefits of using the vaccines now already outweigh the risk, no? And the safety and efficacy of the vaccines have actually been established. And so this is the reason why hindi pa siya tapos, no, sa phase 3 trial, gagamitin na natin. And that's the nature of an EUA. But the moment that one of the vaccines do finish their phase 3 trial, then it has to convert into a CPR or Certificate of Product Registration. Because it's an EUA, the companies that are making the vaccines are not going to be the liable party when something happens, no? Imagine that it's the national government that is requesting from the companies that we want to use your vaccines kahit hindi pa tapos. It's like you cooking something and someone pipilit, no, to taste your adobo, whatever, while you're saying hindi pa siya tapos, no? But because that person needs it already out of emergency because we're in a pandemic, then you allow that person to use. But it's the national government that is taking the liability, so to speak, or the indemnification, diba, that's being talked about in the news. So that's the reason why. And it's also because of this that actually the manufacturers themselves do not want to engage directly with private corporations or private citizens, di ba? Kasi if they engage with private corporations, who will actually be paying for indemnification, etc., if something happens, no? So if you're reading in the news, oh, the government doesn't want private to do it, it's actually the other way around, no? The manufacturers themselves prefer to have the government on board. This summarizes basically the different types of vaccines and what stage they are already in their FDA application process. So we have 4 vaccines now approved by the FDA. So as I was saying kanina, it's not really about the mild COVID infection that we're afraid of, but it's the moderate and severe COVID infections that we're afraid of because you can die from it. So far in the country, we have 2 available vaccines now, and we put them side by side here. And as mentioned, we want everyone to look at not just the ability of the vaccine to prevent mild and moderate infection, but preventing severe infection. Sinabi ko na yun kanina, I repeat it again. We really look at the ability of the vaccines to prevent severe infection. And so far, the vaccines are comparable in this aspect. It's just that for certain vaccines, they're for other age group, and then the other vaccines are for others. So who will need the vaccines first? Many of us are used to getting our vaccines from the market. So the moment we have the money, we expect to get the vaccines. But in this case, we're in a pandemic and in a public health emergency. We need to prioritize who the vaccines, the scarce resources go to. In this case, clearly, no, makikita nyo, on the left-hand side, it's a 20 to 39 years old who constitute most of the cases. But it's the more than 60 years old or the senior citizens who are dying more from COVID. And this is the reason why we do have the prioritization criteria wherein we really begin with frontline workers, the people who will make sure that if we all get sick, there's someone who's going to take care of us in the hospitals, followed by 2 equally vulnerable groups, senior citizens and adults with comorbidities. Finally, we go to frontline workers in essential sectors because they're really too much exposed to other people outside their bubble, followed by the poor because they live inherently in areas where transmission can be high, and then so on and so forth for other population subgroups. So many would ask, I work in the essential sector, but you're a senior citizen, so then you go into A2. You're a teacher, a social worker, but then you're an adult with comorbidities, you have high blood or diabetes, then you go into A3. No? So the main objective really of the prioritization is who has the most risk of dying in the entire Philippines. They need to get their vaccines first. After that, tuloy-tuloy na for all of us. So this one also shows that even within the priority groups, meron pa ring mauuna. No? So NCR would get more of the vaccines because there are more cases here than, say, Batanes, right? In the same way, when we started the rollout of the vaccination, we started with the hospitals who are serving COVID patients versus, say, outpatient clinics who are closed for most of the time or doing telemedicine. So yan, meron siyang prioritization. But now, as we go through priority group A2 or senior citizens, maybe some of you have already gotten the notification from your local government units that you can start getting yourself vaccinated, would be the senior citizens and it's AstraZeneca vaccines available in the country that will be given to you. No? So you begin with really master listing, meaning register with your local government units. But most LGUs actually do already have your names. No? Then followed by A3, which are senior, non-senior adults between 18 to 59 with comorbidities. No? So you need to just show proof of a medical certificate from your attending physician that you've really had conditions. So because of the ECQ and the surge in cases. We are finishing the healthcare workers, hopefully until March 31. But even before that, we are doing simultaneous vaccination already of seniors and adults with comorbidities. No? So in fact, my dad has already been vaccinated yesterday along with my aunt and several members of my family. No? So seniors, mga seniors. So what to expect? So many of you, if you're afraid to go into the vaccination centers, please don't. No, we will be actually doing a fixed point vaccination strategy. It means we won't go house to house to look for you and vaccinate you. You will need to go to a center assigned by your local government unit. It could be a basketball court, it could be the hospital, it could be a clinic, or in certain cases, you could be picked up, no? Or may limited house to house. That would mean seniors who can't travel outside or leave the house. But in general, for every one of us who's healthy and mobile, we need to go to a vaccination post. Overall, you need to master list as a person. You need to register with your LGU and you will get the vaccine for free. Now, I repeat, you will get it for free. The private companies now who want to buy vaccines, they're doing it out of their own goodwill. But I'm telling you all that there is enough stocks that have been bought by the government through the loans with World Bank, ADB, and AIIB. There is enough vaccines. No, it's really a matter of them coming in the next few weeks and months so that we can all avail of it. So hindi kailangan bumili no, ng vaccines. Then rest assured that we do have standards. So kahit City of Manila yan versus City of Pasig, the operational standards are the same. No? All of the LGUs know that, okay, they need to have this types of personnel within the vaccination post so that it will be safe for everyone. So I won't go through it in greater detail, but just to let you know that overall, this is the layout. No? There's a waiting area. Obviously, the people are physically distanced. There's a registration area, a health education and final consent area, then a screening area for your BP, temperature, and then a vaccination area finally. Then you see here, there's a post-vaccination monitoring, meaning people who have no allergic conditions before may only be monitored for the next 15 minutes after vaccination. But those who've had previous allergic reactions, for example, need to stay on for 30 minutes. So there are standard forms also that are being provided as well as a vaccination card. So we also have a standard set of algorithm about who should not get vaccinated or who should be vaccinated. Who should defer vaccination, example, people who had previously had COVID or those in their first trimester of pregnancy. Then we also have certain very limited conditions wherein clearance from attending physician will be needed. So, kunwari, bedridden, with less than 6 months prognosis, those on steroid medication, those transplant patients, etc. Then finally, if you have allergy to food, egg, medicines, or with asthma, as mentioned, you will be looked up for 30 more minutes. But then those with history of bleeding disorders, they will just change the needle that will be used for, the smaller gauge needles. Rest assured also that reactions like this, like local pain, swelling, and redness are normal. No, we don't have to be afraid, and these are expected reactions. In general, we see around 3% of those who get vaccinated to have these reactions, and the reactions are actually more among younger people than senior citizens, or than older adults. So if it happens to be that the vaccination post is not in a hospital, rest assured that part of the protocol of all LGUs is that there will be an ambulance on standby and it's linked to a hospital. No? So planned yun lahat. They wouldn't really set up a tent, a vaccination tent there if there's no ambulance and there's no way to reach a hospital in X number of minutes. So many are also asking, should I be afraid of COVID vaccination? So I just show you data here. To this date, 128 million people in the world have had COVID and 2.8 million people have died, at least registered deaths. So marami pang unlikely hindi na kasama dito. But of that, you will see that in the world, around 559 million doses have already been deployed. And even if you've read a lot of things that, okay, this person got the vaccine, died from whatever, so far, all of the medical authorities globally that are studying this, the deaths caused by COVID vaccines is still zero. So that should let you know of the safety profile of our vaccines. So when are the vaccines arriving? Many of the supply has gone to rich countries, but this is from Secretary Galvez. This is the number of deliveries that will be coming in the next few quarters. Tuloy-tuloy na to. The question now is, when the vaccines do arrive, are we all ready? And this is partly the reason why we're grateful for groups that organize events like this, because we're able to explain to all of you and talk to you about the benefits of the vaccination program, so that you may decide to get yourselves vaccinated, as well as your family, your friends, and your co-workers. So dadating yung mga bakuna. It's a matter of tayo ba papayag magpabakuna. So funds have already been set aside also for the vaccines. So how do we convince as many people to get vaccinated? This is really just a framework that WHO and UNICEF use now to determine what makes people more motivated or less motivated to get themselves vaccination. There are a lot of words, but this just means a few things for us. First is to read and verify what you're reading. Ask knowledgeable health professionals. Share only vetted information, otherwise you will be an agent of fake news or misinformation. Positively influence other people. And if you're unsure, please filter also. Filter yourself, diba? Because you might be unduly negatively influencing other people. Then finally, for access issues, really follow announcements by the DOH, by your LGU, or in some cases, if your employers have committed to buying vaccines, then follow on their announcements so that you know where to go and what to do before then. I leave you with some of the links to materials that we have been producing, summaries of evidence on vaccine, videos that you might want to use amongst your families or even in workplaces. If some of you are owners or administrators of certain workplaces. I also encourage you to join the DOH Philippines Viber group. We're now at 2.3 million members because you get the most accurate and timely information through these channels and our other social media pages. So that would be all. Thank you very much for this opportunity.
Thank you so much, Dr. Ho, for the very informative presentation. We are now open to questions for Dr. Ho. We have requested one of our friends to moderate the open forum. May we invite Ms. Shar to join Dr. Ho? Thank you so much.
Thank you, Sophia. Good afternoon, Dr. Ho. In the interest of time and efficiency, we've asked registrants to give their questions and consolidated these questions. But now I will just try to ask the relevant questions. First of all, Dr. Ho, what are the profiles of people who should get or not get vaccines? I believe you have mentioned some information a while ago, but I think the questions mainly focus on the age and people with existing conditions, plus for those who have had COVID-19, how will the illness be in terms of severity? Will it be more severe if you have had COVID-19 already, as opposed to someone who has not been vaccinated?
Okay, thank you for that. So in general, we want everyone to get themselves vaccinated. So instead of focusing that am I part of those excluded, almost all of us no, are eligible to get vaccinated, except for a few. Like if they are kids less than 16 years old, then you shouldn't get vaccinated. If you've had previous severe allergic reactions, then for some types of vaccines you can't. No, but if it's just minor allergies from food, from egg, then you're still allowed to get it. For those I mentioned, severe conditions like bedridden in palliative care, you are still eligible to get it. It's really just a question of how much your medical practitioner is confident no, for you to get it. Kasi for example, if you're already bedridden and palliative condition, it might not be worth it to actually experience some of the adverse reactions pa, di ba? So, but in general, many of us are eligible. It's really a question of timing, no? So, if you've had COVID, then you'll wait it out 90 days after before you get your shot. If you're not feeling well, you don't want to be confused. Is this adverse reaction from the vaccine or am I really just not feeling well? No, so you don't opt for vaccination. If you're pregnant, the advice is first trimester, not get vaccinated, but after that, get vaccinated. So overall, you should have the mindset that you will get the vaccine unless otherwise stated.
Okay, thank you for that. We have another question. It goes, is it safe to take more than one vaccine brand? I think it's one vaccine with dosages or two dosages of different brands. What's your take on it?
No. So the advice is really just you take the same brand, and each brand of vaccine will have different duration of per second dose. No, so AstraZeneca now the studies are showing you need to take it after 12 weeks to get maximum impact. But for Sinovac, it's 28 days.
Okay, okay. And we have another question. Are there studies or plans put in place for an oral vaccine like that of anti-polio vaccine?
I think many of the scientists worldwide are studying different forms, inhaled version, etc. But for now, we are focused on deploying these vaccines.
Okay. There's a question on, particularly on Sinovac. Is Sinovac vaccine safe? Is there a carcinogenic compound in it?
So any vaccine that has been approved by our Philippine FDA means that it has gotten through two expert panels. No, our vaccine expert panel, they're made up of scientists and researchers, and our clinical panel within the FDA. So rest assured that if something bad is in those vaccines, they wouldn't have passed the approval process.
Okay, we have this, I think this is more of a medical question here. What are your comments or stand regarding taking, do I say it correctly, ivermectin instead of the vaccine?
So we follow evidence-based practice, no? Because that's the science that you can stand your ground on. So far in the world, there are around 70 clinical trials that are studying ivermectin and its use in COVID-19. So pending results of these and knowing fully well that ivermectin is now only being used for animals, and in the past, it's being used for certain types of parasitic infections, but their own manufacturer, Merck, has actually withdrawn already their permits for this. Even the primary manufacturer or the patent holder has withdrew any of their licenses for this. Then it doesn't have any legal indication for use in the Philippines. No? So hindi mo na siya for now because we follow evidence.
Okay, thank you for that. We have a couple of questions regarding government related. There are surveys that show that 46 to 47% of the adult Filipinos are unwilling to be vaccinated against COVID-19. What is the government doing so that more Filipinos will agree to this vaccination program of our government?
So we are studying the data, and based on what we know, the main influencers of the Filipinos in terms of who will influence them to get vaccinated are top three. No? So first is still health authorities, second are healthcare professionals, and third, their families and friends. No? At the first phase of the vaccination process, our goal was to get healthcare workers on board. And this is not just because they are injectees no, or vaccinees, but they're going to be the best champions. So what we've seen is that the inoculation among healthcare workers has created a bandwagon effect, right? And we're looking at this as a possible trigger no, for better acceptance of the public. We've been here in the past, but we've been able to raise vaccine confidence with the help of our healthcare professionals and civil society organizations. So I'm very confident that we will be able to do it again now, no, with partnership, with a lot of partnerships. So far, we've been working with institute-specific or sector-specific leaders so that it's more actionable. Like town halls like this, we begin with polls, entry poll, exit polls, so that the HR or the administration responsible for the group, they also know what types of messages to continue giving that population segment.
Okay, thank you for that. Another question is, what is the arrangement of the government with the private sector?
So far, what we have are tripartite agreements, and that means that the private sector will be able to purchase vaccines from the manufacturers only with the government in that agreement. And that's really because the manufacturers, as I've mentioned, will need the government to be there to vouch for indemnification if ever. The private sector are committed to not earn or not sell, actually, because EUA prohibits selling, to not sell the vaccines and actually provide it for free to their employees. So that's really the partnership now.
Okay, for Sinovac, what do you think of the efficacy results of Sinovac versus the other vaccines? Is there a vaccine in particular that may have less side effects than the others?
So as we've mentioned a while ago, for us, anything that the FDA has already put its stamp on, those are comparable vaccines. No? So for now, the 4 vaccines that have been approved are all comparable.
Okay. We have a few questions on research related. Did China officially report about the data on Sinovac vaccines to the World Health Organization?
I think it's better to ask the next speaker about it. But we are aware that those who submit data to us, they're also submitting data to WHO to be listed in the WHO EUL.
Okay. What is the timeline for the full vaccine rollout? Do we have enough for the public?
As I've shown you on screen, yes, we do have enough. We've ordered 140 million doses. Of course, the full control will not be with us because the manufacturers are all outside the country and they all have what we are calling now vaccine diplomacy, right? Every country is trying to finish their own population, and so they're withholding vaccines from other countries. No, but we're hoping that with the good partnerships that we've been having, the vaccines will arrive on time. So the challenge now is to do good ground preparation so that when we're at 20 million vaccines per month arriving in the country, the people are actually going to be ready to be vaccinated.
Okay. There's another question here. Is DOH using contact tracing data to make decisions? Why is the public not being educated aggressively on the importance of contact tracing mass testing and virus incubation period?
Well, we've done so much communication already about this. Perhaps it really depends on um, pandemic fatigue to a certain extent. Um, but if you've been seeing all our communication, it's been repeatedly mentioned. No, I think what we shouldn't discount are the fact that there are inherent economic disincentives for people to not do this. Right? If you're a daily wage earner, why will you undertake isolation when it means that you won't be able to bring in food, diba, for your family for days, actually not even just a day, no? So there are issues that go beyond just the health sector. When you talk about contact tracing, it's easy to say an app, right? But do you know how many Filipinos actually do own a smartphone? And of those, how many actually have internet, right, or mobile internet on their phone, no? So there are inherent challenges. There's no excuse for that, but it won't be the task of a single agency. It also won't just be the task of the government, especially now that people are going to work. It is expected that employers also do their share. They have a safety plan that's in place, and also employee education. So we've done that last year extensively with HRs of companies and safety officers with the Department of Labor and Employment as well.
Thank you very much, Dr. Ho. As just a concluding question for you, as a health professional and a government employee, what is your message to the Filipino citizens out there who may still have doubts in getting the vaccine, and to those who would like to get the vaccine but are having difficulties accessing them? How do you think the world can consolidate and operate more in vaccination in cure of the COVID-19?
I think the fact that the vaccines were produced in a short period of time is already a testament that the world has helped each other out. However, though, there are political pressures in all corners of the world now for them to mass vaccinate everyone in their country. While there is optimism in that, I think it has to be made clear to all of us that the vaccines won't be a silver bullet in ending the pandemic, no? Especially now, I'm sure you're seeing a lot of articles talking about could this be a yearly thing, etc. That said, we don't want us, our family members, to die from COVID. And COVID sneaks up on us, especially at times when we actually feel very tired about practicing the minimum health standards. No? So it takes a lot of consistency in performing the minimum health standards correctly all the time. And the moment that we lose such consistency, the virus sneaks into us. And that's really what the vaccines will help us with, no? So it's an added layer of protection for us. If you don't want to do it for yourself, then do it for the kids in your family and your household, in your workplace, whatever, because they wouldn't be able to get the vaccines. If you don't want to do it for your lolo, lola, your senior parents. Typically in the Philippines, we live in multi-generation households, and that means that inevitably you will let your guards down at home, and you will likely going to be able to infect, no? If you're relatively healthy, you will likely going to infect your parents, your elderlies at home, no? So do it. If not for yourself, do it for them. And remember, as long as it's not all of us who will do it, there's no point, diba? The value of the vaccines is collective, no? So we have to also do our part, not just in getting ourselves and our family vaccinated, but really strongly advocating for it. The people who don't want us to get vaccinated, they seem to be louder and more aggressive on social media and various platforms. And I think we as responsible citizens and humans will actually need to do this so that we protect more lives, young, old, or even our own. So thank you, Shar.
Thank you very much, Dr. Ho. Thank you, Beverly. I'll bring it back to Sophia.
Thank you so much, Dr. Beverly Ho and Ms. Shar, and to all our participants who sent their questions. Now we are moving to the next part of our webinar. Allow me to introduce our next speaker. Ms. Helen Yang is the General Manager of Sinovac Biotech Hong Kong. She is also the Senior Director of Global Business Development at Sinovac, as well as the Head of Investor Relations and Secretary to the Board of Directors of Sinovac. Ms. Yang joined Sinovac since 2003 and has approximately 20 years of experience in the vaccine industry. Ms. Yang obtained her MBA with outstanding graduate results from Peking University and Blerick Leuven Management School, Belgium in 2011. Prior to that, she finished a Master of Science honors program from the University of Reading, UK in 2003. Again, let us all welcome Ms. Helen Yang. May we invite Ms. Helen to please share her presentation?
Yep. Yep, can you see it?
Yes, Ms. Yang.
Great. Thank you, Dr. Palenka and Dr. Liang for inviting me. I think this is a very critical moment for the whole world. And I feel that everyone is focusing on vaccines, trying to learn what is vaccines, how it's going to work, a lot more than in the past. So I'd like to take a few minutes to firstly introduce who is Sinovac. So Sinovac is a business focused on human vaccine research, development, manufacturing, and commercializations. The organization was started almost 20 years ago. We started in 2001, and we found the company in Sinovac in Beijing by a group of scientists who start from developing the first inactivated hepatitis A vaccine in China. And actually, the development of our history is along with additional products we developed for China and for the world. Our mission is to provide children in China with a vaccine of a high quality, as well as providing vaccines to the children around the world from China. So throughout these 20 years, we have about 10 products being developed by ourselves. That include, as I mentioned, the first Hep A vaccine in China, and the only second combo Hep A and B vaccine in the world. And also we have a class of flu vaccines, including the trivalent influenza vaccine, pandemic influenza vaccine against H5N1. We also call the avian flu vaccine for human. And also H1N1 flu vaccine back to the year of 2009. And lately in this year, in the past 3 years, we also have varicella vaccine, quadrivalent flu vaccines, and pneumococcal polysaccharide vaccines and mumps vaccine launched the market. We also is one of the first group of companies developing a new kind of vaccine, which is to prevent the hand, foot, and mouth virus, which is mainly a pediatric disease. And this vaccine has been commercialized in China, and this disease also impacting some of Southeast Asian countries. And as I said, we're focused on the science. So our future growth and expansion of the business will be largely relying on vaccine research programs. And currently we have nearly 10 programs on our pipeline, which include a Sabian IPV, which is a partnership with WHO and the Netherlands institutions for developing the inactivated polio vaccine in order to eradicate polio worldwide. We also is in the line to develop a combo vaccine based on the IPV together to combine with DTaP and HIV, the combo vaccine, which we expect in the future for the vaccine business the combo vaccine will become a big trend because that will reduce the chance of inoculation, and also that would be reducing the risks associated with a vaccination inoculation itself. And also parents and kids need to visit the clinics fewer times. And therefore that we are also focused on developing a combo vaccine from now on. So going globally has always been part of Sinovac's strategy, but our primary market in the past is still in China. We have been started doing the export almost 10 years ago. And lately, by the year of 2017, our Hep A vaccine was evaluated and assessed by WHO and was granted the WHO pre-qualification. And overall, right now, we have supplied our vaccines, including Hep A and flu, to over 20 countries. And currently, we are registering our vaccines in over 30 countries at the moment. And this is also one part of the strategy to go along with the One Belt and One Road strategy to build up the partnership. Besides of bilateral collaborations, we also work with UNICEF and PAHO to supply our products after our Hep A was evaluated by WHO. And vaccine is a product that before any country use the products, it needs to be approved in any particular country. And we have obtained the over 11 certificates for our facility. And many of them are PICS member countries. So by having that certificates, the other PICS member country can give exemption if we're trying to license our vaccines in those countries. And currently we manufacture most of our products in Beijing. We have previously we have only 2 sites, but after
Good afternoon, everyone. Apologies for the technical difficulty again. We would like to remind everyone that you may send your questions to our speaker via the Google form linked in our chat box.
So can you still hear me?
We can hear you now, Ms. Helen.
Okay, thanks. So together with the COVID-19 vaccine, the overall company's manufacturing capacity is over 2 billion doses. And of course, we are also emphasized on closely working with international organizations. We're a member of International Federation of Pharmaceutical Manufacturers as a flu manufacturer. We are also a member of DCVMN, which is a developing countries vaccine manufacturing network. As I mentioned, that we also as a supplier to UNICEF and PAHO. So let's talk about the COVID. I think starting from early last year, after the outbreak started from China and then quickly spread to the world. I think as a manufacturer, all of our efforts are focusing on whether we can develop a products trying to end this pandemic. The products we were developed is an inactivated. Actually, we tried a few roadmap, but by I think in the early last year, the inactivated COVID-19 vaccine projects turned to be a promising results. So we focus on the inactivated one. And also this technology is not new. This has been widely used technology for many kind of other products like the polio, hepatitis, influenza. So the technology itself is reliable and has been tested massively in the past in millions of human beings. So the safety of the vaccine have been fully proved. So we only need to demonstrate whether the COVID virus is going to work with this technology. And also normally for inactivated vaccine, is only is required to be stored and transported at a positive 2 to 8 degrees Celsius. So it's similar to other normal vaccines. So all the refrigerators and also the airplanes have an existing infrastructure to deliver and store the products, which will be providing easy access to the people living in different conditions in the world. So what we are supplying is both pre-filled syringe and vaccines in vial. But of course, right now there is a global shortage of supply of syringes. So now we are providing mainly provide the vaccines in the vial. And we design a 40 vial per box, which save a lot of space. So when we do this massive inoculation against the pandemic, these type of packages can improve the efficiency of delivery, and that also speed up the process of vaccination. And together with that, we also offer another type of partnership, which we did with our Brazilian partners, Indonesian partners, as well as Turkish partners. That we supply them ready to fill box. If you see on the picture, is in a big tank. And we ship to them, and they do a local filling and packaging, and also the release testing by themselves in the country. And we think through this way, we can share the capacity. So the pressure is not only on us. We think the global partnership will be extremely important for everyone to having the access to the vaccines as soon as we can. And of course, in order to having the products, the development is matters a lot. Actually, as the prior speaker mentioned, the vaccine development only take a year, which has never been happens for a normal vaccine development. Normally, it takes 5 to 10 years to have a product. So for the COVID-19 vaccine from Sinovac, the name of the vaccine is CoronaVac. We initiate the projects in January 28th, 2020. Soon after the Wuhan announced that the pandemic in Wuhan happens. At the beginning, we thought that might be another SARS, and I think 20 years ago, we had an experience of developing a SARS vaccine, and also it is an inactivated. So the key members and technology know-how still exists in the company. That's why when COVID come again, we quickly run up our capabilities and platforms to start developing of these products. So we start from the virus screening and isolation, and this is the starting point for an inactivated vaccine. And for this vaccine, for this virus, it is highly contagious. So the isolation of the virus is in a partnership with the Chinese Centers of Disease Control and in their biosafety level 3 laboratory. And we screen among a few dozen virus isolated from the patients. And we finally select the one with a good yield. And then we inoculate the virus into the cell and to multiply on the cell. And then we'll go through the purification and the inactivation to finally obtain the products. And of course, in order to maintain the quality at each step of the production, from starting point until the end, we have developed a thorough list of assays to test the quality of our products. And this experience also is what we have collected in the past 20 years while we are running our business. So after we have the roadmap developed for a inactivated COVID-19 vaccine, firstly, we need to test it on animals. In a normal way of vaccine development, we'll start from smaller animals like mice, and then we go to rabbits, and finally go to the monkeys. So we can make the selection of the dosage and schedule. But now we are running against the time. We have seen the reported cases and fatal cases increase day by day. So I think the company have put a lot of resources and planned the programs all in parallel. So we have a low dose, middle dose, and high dose, and different schedules. And we do it all at the same time on different type of animals. And in order to receive the results in the shortest of time, and that will maintain that we we conduct everything we need to do, but we save time. So finally, on the animal challenge study, which is on monkey, rhesus macaca, is a kind of monkey. After we inoculate the vaccine, we also give a challenge of the virus in the lungs of monkey. And that result is very promising. That shows the monkeys with immunization successfully against the attack by the virus. And on May 5th, we published this result on the Science. And that's also give us the foundation for us to be approved, enter into the human trial. So in China, we were approved by the Chinese FDA, we call it an NMPA, to conduct a human trial, phase 1 and phase 2, starting in April, mid of April last year. And following the ethical sequence, we start from adult group, 18 to 59 years old, and then move into elderlies. And recently, we just completed the pediatric pediatric trial in phase 1 and phase 2. And based on the phase 1 and phase 2 results, the vaccine showing to be a good good safety profile, and also it is well tolerated among different age group. And this is also give us the enough data to support us moving into the phase 3. So the matter really comes from the phase 3, because normally conducting a phase 3 efficacy study, we need to make a testing in 2 different groups of people. One group received the vaccine, the other group receive a placebo. And then we will let them to go back to live as a normal. So, and then we will closely monitoring them how many infected cases from this group. And then we will analyze how many cases from the vaccine group, how many from the placebo, and then make a calculation to come up with the efficacy rate. So, but now China have implemented very strict measure on the lockdown policy. So people can live in the country very safely. But for conducting a trial, we don't have the condition because we don't have the reported cases. Those are the required conditions for conducting the phase 3. And that's why we have to find a partnership in the other countries who are currently endemic to host our trial. So that's why I think for the COVID vaccine development, if it is not a global partnership, I don't think we'll be successfully have this product by now. And of course, so many countries not able to have access to our vaccine. And starting from July, we start to initiate a trial in Brazil. And then in August, we start in Indonesia. And in September, we started in Turkey. And now we are still conducting the phase 3 trial in Chile. And with the partnership and strong support for those countries and our partners, we have conducted a large-scale trial for almost 30,000 volunteers. And the trial data, I will talk about in a later slide, have been obtained from preliminary study. But again, this research has not been completed, even though we have received the emergency use approval. And in China, we were granted a conditional marketing authorization. But the research has to be keep going, like to observe the consistency of the antibodies. And also we need to see how the use of the vaccine combined with other vaccinations, like for flu or pneumonia. So there are a lot of research has to be conducted. That's why currently the approval is only for emergency use. And also the conditions attached to the marketing authorization has to be fulfilled. And this is what we are doing right now, and also maybe extended to next year and even year after. So I think for Sinovac, we always want to share with our achievement to the international society. I mentioned about the science articles, which are the animal challenge study. We also announced our phase 1 and phase 2 study on adults on the Lancet, as well as elderlies, about our research results. And we do welcome who are interested can take a look. And regarding to after we conduct the phase 1 and phase 2, I slightly talk about the phase 3, and these slides provide more detailed information for phase 3, because I receive a lot of questions about why those trials are different, how to interpret the numbers. Actually, Sinovac provided the vaccine from the same lots to Turkey, to Brazil, to Chile, and Indonesia for clinical studies. And these 4 different trials are actually run by different principal investigators. And those are independent trials. So it's different from other suppliers, other manufacturers. They do the multi-center trial, which is following a unified protocol. And also the targeted population or vaccinees for different trials are different. In Brazil, for example, we conduct the trials to about 13,000 people, and all of them are the medical staff. And those medical staff are those who directly handle the COVID patients. So they have a lot more chance got in front of the virus. And in Turkey, this is a 2-step trial. We start with a few hundred healthcare workers, and then we move into the general population. So altogether, it's another 13,000 trial. Oh, I forgot to mention that in Brazil, actually the vaccinees, including elderlies, we have a few hundred elderlies in this trial. And Indonesia is more like the efficacy and in immunogenicity study to see the seroconversion rate, meaning after receiving vaccination, how many of them can induce the antibody. So again, Chile is a medical and plus the general population. But when we start the trial in Chile, the vaccinations rollout has already been started. And therefore that from the ethical point of view, that we're not allowed to give placebo to people because they would be eligible to receive a vaccine. It will not be ethical to give them a placebo. So we will do the trial to observe the safety and immunogenicity for our vaccines for different immunization schedule. And we recently see that the Chilean partner to provide a preliminary results showing that the vaccine having a good safety and immunogenicity data. So overall, safety is a very key issue that everyone cares. Let's put aside about how effective of the vaccine is. Before people use, people will think after I take the vaccination, what would happen to me? So for CoronaVac, as I said, inactivated vaccine, one of its advantages is that it have a very good safety history. And this reflected from CoronaVac based on our study. And we have seen that the adverse reaction at the inoculation site showing most of the common side effect is a pain at the injection site. And also some other mild symptoms. And the systematic adverse reaction, including a headache and fatigue. And most of the severe adverse reactions are not much actually. Clinically, comparing to the placebo group, they're similar. Most of these are only grade 1, which is still, even we call it the most of the severe adverse reaction is only grade 3. And until now, all the reported serious adverse event was not, none of them judged to be related to the vaccine. So for running a trial, we, just for your information, we collect all the reported adverse event, and we will do the grading based on the symptoms. And then the expert will judge whether this side effect is caused by the vaccine based on the clinical knowledge, and also the and also comparing to the placebo group. So all this research has been conducted based on the international GCP standards, and especially for our Brazilian trial, the data monitoring committee were also consisted by the US and European and Asia experts, and of course Brazilian experts as well, to ensure the standardization of our data. So in terms of the antibody induced after receiving the vaccine, we have seen from all this trial that the seroconversion rate can be as high as 97%. And we also conduct the cross-neutralization testing with the different strains, because this strain we developed the vaccine is the one we isolated from China. And you know, for China, they strictly collect the patients doing the testing when they are flying from different countries back to China. And once they collect those, once they find any PCR positive cases, they will have a sample, and then we'll have a chance to receive the new strains, and we are going to use the blood serum of those people who were immunized with our vaccine to do the neutralization with the new strain. And currently we have obtained over 10 new strains from Europe, from Latin America, and Asia. And currently we have seen the neutralization effect with the serum, blood serum using our vaccines is pretty good. But now we're still keep on researching based on the South African strains as well as the new variant from Brazil. Our Brazilian partner in Brazil is currently working on that. And they made the preliminary announcement saying that they see a promising results for our vaccines against the Brazilian new variant. So we are still looking forward to the more detailed data for these results. And in terms of the efficacy, I do agree with the prior speaker's point that we need to focus on using the vaccine to prevent the hospitalized and severe cases, especially for the fatal cases. That's something we need to care about. And no matter from our Turkish trial or from Brazil trial, and the efficacy rate against this type of situation are all 100%, which is a very strong, very good results for us to ensure that the vaccine is effective. And also we have observed for the moderate cases, which requiring the medical intervention, the efficacy rate is over 80%. And that means that some people, if they need to seek the doctor's assistance, and for those type of severity of the cases, 80% of them can be avoided if they're vaccinated. And of course, if we are talking about the overall, all the participants into the trial, for the general population in the Turkish trial, they announced the preliminary results, and the interim data is over 90%. And recently they announced the final result is over 83%. And for the high-risk medical staff in Brazil, the overall efficacy rate is also over 50%. But for this group of people, the attack rate for the disease is 4 times higher than the general population. So we don't feel surprised for this lower number of efficacy if they are putting into this high-risk environment. But this will not be replicated into the general population. So therefore that for the Turkish trial, the overall efficacy rate is high. But again, I think we need to emphasize on whether this vaccine can prevent fatal cases, severe cases, and those who need to use the hospitalized. And that actually increased the burden for the society to have to maintain the bed in place to cure enough patients and to run the society normally. So in terms of the, we think for using the vaccine or to use vaccine to stop the pandemic, the vaccine deployment will be a critical issue now. We have gone through the development. Now we are facing the, or we are working on whether we can having a orderly managed deployment schedule to ensure that the countries can receive the vaccine in time. So now for Sinovac, we have already built a facility in the city of Beijing in south for producing, dedicated for producing COVID. And we have, we at the beginning, frankly speaking, only built a capacity of 300 million doses. And then we realized that those are not enough, even for China. So that we don't need to talk about other countries. But we have a strong commitment with our partners who are expecting our vaccines. That's why we doubled our capacity from 300 million to 600 million. And then we feel that's not enough either. And then now we have already built up capacity, annual capacity to 1 billion doses. But again, we think it's not enough. So we are currently working on expanding our capacity from 1 billion to 2 billion doses. And we expect this new capacity could be available sometime in June. So by then we would expect our capability of supplying can be doubled. And of course, in order to having the vaccine approved, we have also received the inspection from Indonesian FDA, Invisa from Brazil, and ISP from Chile, and also the Chinese inspector as well. And we do appreciate those inspectors. They actually fly over to Beijing and they conduct a quarantine in China before they come to us. But they are facing the challenge of being potentially infected while during this pandemic. And they are very brave and they did their job and they inspect the facility in order to allow their people to have access of vaccines. We very much appreciate their efforts and bravery. And also WHO inspection team came to us in February as well to potentially evaluate our COVID-19 vaccine to be listed on the emergency use listing by WHO. So currently we work closely with WHO to answer all their questions. We were also listed on WHO website, and according to WHO expectation, if everything goes well, we may expecting the approval sometime in April. So if we have that approved, then I think we will be able to help more countries than now. So by now, overall, we have been approved by nearly 30 countries and regions in the world, including China. And of course, for in Asia, we are approved by Indonesia, and also we are approved by a HALA agency, UMI, and also in Thailand. We didn't have a map here. Cambodia, we also and also Hong Kong as a region approved the use of our vaccines. And of course, in Latin American countries like Brazil, Colombia, Mexico, Chile, Uruguay, and Paraguay, there also are approved and to use our vaccine at the moment. And we think only more and more countries start to use the vaccines, and we might have a chance to finally stop the transmission of the virus. And the use of the vaccine also part of the global partnership. So not only from vaccine development purposes, but also the use. So I think overall, in order to win this pandemic, really to help the world go back to normal, the global partnership play a significant role in this whole process. And that's why we strongly encourage that every country together with us to share no matter the technology or your show up on the vaccination, and as well as the still keep yourself protected even you are vaccinated, because that needs to take time to build the immunity herd. And this is not the end of the game. We also need to work on the new variant. If the new variant shows that the original vaccine doesn't work, then we need to develop a new vaccine. Therefore, that on March 22nd, Sinovac hosted international academic conferences. We also invite some of the friends from Philippines to participate. And in that conferences, we invite the principal investigator who run our trials to explain the trial and the results they obtained. And also some country, they explain how they see the impact of using vaccines to the reported cases in their country, which are very promising. And therefore that in that conference, Sinovac chairman had announced a few initiatives that we want to support different countries to do the epidemiology study for COVID. We are also would like to support country to study on to develop a vaccine against the new variant. And also we would like to work with different countries on the real world study of using CoronaVac, meaning that in some particular areas, if the conditions allowed, we can give a vaccination to the people living in that area. And then we can observe how the epidemic situation being impacted before and after using the vaccine. And also if Philippines is interested, we of course would like to discuss further on the potential collaboration on this research. And now this kind of research has already been started in Brazil and Chile. We aim to expanding into more countries so people will understand how to use the vaccine to really making an impact. So I think that we also need to appreciate that once our vaccine is being shipped to different countries, the officials and celebrities, they are all participated and show up to receive the vaccination in order to encourage their country to follow their action. We've seen the president of Indonesia, Joko, to receive the vaccine as the first president who received our vaccines in the world, and then followed by the Turkish president Erdogan. And we see that in the left-hand side at the bottom is the president of Chile. And we also have the deputy prime minister of Thailand receive the vaccine, and a lot of celebrities in sport and in art. So we're very encouraging by their enthusiasm trying to promote vaccination, because everyone realized vaccine is the end game and we need to make that happen. So by now, Sinovac is as one of the large supplier of a COVID-19 vaccine. We have already contributed 1/6 of the global vaccination by mid of March. Now I think these numbers are still growing. By now, the whole world have already been immunized over 400 million doses, mainly in the developed countries. But Sinovac is trying to help more developing countries at the moment, including China, of course. And now over 70 million doses of Sinovac vaccine have been used worldwide. And we have not received any reported serious adverse event, which is vaccine related, which we have a strong confidence about the safety of our vaccine. And with that, I want to emphasize that what Sinovac is doing is trying to supply vaccines to eliminate human diseases. And thank you very much for your listening, and I'm welcome to the questions.
Thank you so much, Ms. Yang, for the very informative presentation. We are now open to questions for Ms. Yang. May we invite again Ms. Char, our moderator for our open forum.
Thank you, Sophia. Again, I would just like to share that in the interest of time and efficiency, the Institute has asked registrants to give their questions for consolidation of relevant questions. Dr. Yang?
Yes.
Questions regarding the Sinovac vaccine. So there's a question that goes, why do we avail of Sinovac as against other vaccines available in the market? Who should or should not get the Sinovac vaccine?
Sure. For actually, our vaccine have been approved in China for people above 18 years old. And our vaccine being used in some country for people aged from 18 to 59 years old. And in some other countries like Brazil, Turkey, they also include elderly as the high priority group. So it's a matter of how each government decide who should use the vaccine. And we also conduct the clinical study on the pediatric population for the kids starting from 3 years old to 17 years old. And we recently shared the results, and we are going to do to publish the full report very soon.
Okay. So for the initial report we received is like 59 years old, right? So right now it's okay, like the 60 years old and above.
Sorry, I didn't get your question. Can you please say that again?
Okay, we received another question confirming that elders who are 60s, in their 60s, are okay to receive the Sinovac vaccine.
Yes, in our phase 1 and phase 2 study, we did conduct the clinical research on elderly. And in phase 3 in Brazil, we also have over 600 elderly people. And actually in Brazil, they have already give vaccination to elderly. I think the most senior lady who received our vaccine aged 107 years old.
Oh, okay. Okay, we have another question on, again, it has been said that Sinovac has a low efficacy rate compared to the other vaccines. Can you please enlighten us on this?
Sure. I think firstly, I think even for ourselves, the different trials can't be compared because those are not apple-to-apple comparison. And for our vaccines efficacy rate, it is not able to compare with other products because the protocols are different, the testing point are different, how to analyze the cases are different. So that's why I would strongly suggest that people looking at the prevention rate against the fatal cases, severe cases, and hospitalized cases.
Okay, I have another question on when does Sinovac expect the World Health Organization to include them in their EUL? Or did China officially report the data on Sinovac vaccines to the organization?
Actually, the applicant for the EUL was done by Sinovac. We are a company, and we make the application, and we directly communicate with WHO. They came to inspect us in February, and based on WHO's expectation, they may draw a conclusion in April. And now we're directly working with WHO. China doesn't help us to make any submission.
Okay. How extensive are your safety studies for the Sinovac COVID-19 vaccine? Are there safety and efficacy results of the vaccine published in the mainstream medical journals?
Actually, in terms of safety, we firstly studied that in the clinical trials, the pre-licensure trial, which already over 30,000 volunteers. And then we were approved to provide the vaccine under emergency use in China and also in some other countries. So collectively, there are over 70 million people have received our vaccine. And we actively collecting the reported side effects. So until now, the reported side effect is very, very low. And there are no severe adverse reaction being judged related to the vaccine. So that shows the safety of our vaccine is very good.
Thank you, Dr. Yang. We have another question. It goes, aside from China, where did you conduct studies on its effectivity? Would you advise where we can get more updated statistical facts on testing and results to minimize fear in communities from getting vaccinated?
Actually, we have already started doing the trials in other countries, and we selected in different continents, if you see, in Brazil, Latin America, Indonesia and Asia, Turkey and Middle East, and also in Chile as well. And because right now, more and more countries start to initiate the vaccination rollout. So from an ethical point of view, it is not ethical to test the vaccine with placebo. So we aim, as I explained the initiative from Sinovac, that we are aiming to do the real world study to promote to understand better about in the real world how use the vaccine to impact on the epidemic of the disease. So right now we plan to do more, and we collaborate with Brazil, Chile, and we want to work with more countries on that. I think once more and more data comes out, it may people's fear might be goes away. But I think also this needs to be a close partnership between the public and private entity to do more this type of talk. I think the prior speaker were very, very good to explaining how vaccine works. So that will help the general population to understand this epidemic issue easily.
Dr. Yang, you mentioned the private sector. Okay, I think this question is more relevant. Would the Sinovac vaccine come in and be sold commercially instead of having to pass through supposed tripartite agreements, including the government? How can one order vaccines for himself, his family, or his own organization?
Right. Actually, now for the vaccine supply, we mainly dealing with the government, but who is eligible to buy the vaccine is a country's policy. I saw that in Philippines, it is allowed the private sector to buy, but actually, no matter who buys, currently the overall supply is still in a shortage. But we do regard our partnership with Philippines as a high priority. So that's why, even though we are facing a big pressure on the supply, we still squeeze like 1 million doses for Philippines, and the vaccine already shipped to Manila yesterday or the day before yesterday.
Talking about the government, Dr. Yang, there's another question on diplomacy. What can you say about Sinovac being used by the Chinese government in vaccine diplomacy in a country where there may be some diplomatic issues existing, like the Philippines?
I think for Sinovac's mission is trying to provide the products to eliminate the disease, no matter from the, we are trying to do that through different ways. Either we do a bilateral collaboration with different countries, or also our partners came to us and trying to ask for help. And also Chinese government is doing on their part. It's not different for us to provide a vaccine. As long as the vaccines can reach to the country and people can use it as soon as they can, I think our work is worth.
Okay. Okay, lastly, regarding the Sinovac, what are the common symptoms of Sinovac after the injection, this post-vaccination? When do side effects start? For how long does the side effect stay?
Right. I think most of the side effect is pain at the injection site. We had some fever, but very low rate and not different from placebo group. And the pain may goes away after a few hours. I might personally received the vaccine sometime last year, and I start to feel the pain like a half an hour after vaccination, and then it goes away like 1 and 2 hours later. And after I got the second shot, I didn't feel anything.
Okay, thanks for sharing that, Dr. Yang. As a concluding question, as a figurehead of a pharmaceutical company, Sinovac Biotech, how can you convince the Filipino people to trust in your product? Many people say that Sinovac is being distributed out of political motive. Can you share your thoughts on this on this position? And how do you think the world can consolidate and operate more in vaccination and cure of the COVID-19?
Sure. What I want to say is that using vaccine serves a purpose, which is to stop the transmission. So because vaccine were developed scientifically, and we need to treat this issue scientifically. If our data says the vaccine is safe, it doesn't matter why it's there. It's a matter of whether the people can have the good vaccine to be used and whether we can protect ourselves. And our vaccine has already been used over 17 million people, and the safety already been fully demonstrated. And we see so many government officials, celebrities, and different minorities using our vaccines. Therefore, that we have a full confidence. And through the efficacy study, we show that the vaccine can effectively protect people from getting very, very sick or even death. So that is something we are looking for.
Thank you very much, Dr. Yang. Thank you for sharing your expertise. Sophia?
Yep, thank you. Thank you so much.
Thank you very much, Ms. Yang and Ms. Shar, and to our participants who sent in their questions. Before we conclude our webinar, I would like to remind everyone that the evaluation form will be made available after the event. Participants who also wish to rewatch the video, the whole webinar, this video will remain on Facebook and will soon be uploaded on our YouTube channel as well. Now, we would like to call in our director of the Confucius Institute at the Ateneo de Manila University, Dr. HELEN H. Palanca, to give us the closing remarks.
Dr. Palanca is on
Dr.
mute.
Palanca?
Hi, Sophia. Dr. Palanca is muted.
Hello, hello. Hello, can you hear me now?
Yes, Dr. Palanca, we can hear you.
Yeah, I think you will all agree with me that the two speakers are both very remarkable. I learned a lot, and with Dr. Ho's talk, it was very, very informative. The presentation of the PPT of very nice illustrations, I think will convince all of us to share. Ms. Helen Yang gave us a history of the development of the Sinovac vaccine, as well as its deployment globally with other countries. And we have seen the positive results of their trials and experiments. And now we can very confidently to have Sinovac being used for its efficacy and as well as its safety. So thank you so much, Dr. Ho and Ms. Yang, and we hope that you can talk to us again because I think there will be more development in this area. So I would like to also thank Dr. Liang for her support and also the team that provided our technical support for the webinar this afternoon. Thank you so much for making this a success. So with that, we conclude this afternoon's webinar. Sophia, you want to conclude it?
Thank you very much, Dr. Palanca. That ends our webinar today. We hope to see you in our future webinars again. Just a reminder as well, the link to our evaluation form is already posted in our chat box as well. With that, we conclude our event. Thank you, everyone, and have a nice day ahead.
Okay, Dr. Tan, thank you.
Oh yeah, it's
Hey,
my
Dr.
pleasure.
Tan, thank you so
Congratulations.
much. Thank you all, guys.
Yeah. Congratulations.
Guys, I think it was a very informative webinar.
Dr. Plaka.
Yeah, bye-bye.
Bye-bye. Bye-bye.
Yeah.
Thank you, Sophia, Jar, and all of our staff.
Yeah, our moderator also. Yeah.
Congratulations to all.